Hello, I'm Dr. Chin. Today, we will focus on the parotid gland. We will go over how to scan and position. You will need a linear probe for this scan. Let's start with the parotid gland. First, to ask the patient to look to the right side. Use the posterior of the face as the landmark. This place is the mandible bone. This position is the mastoid. Place the probe under the earlobe. Scan where the two bones are connected. I will recommend to use small part for the preset. The depth of the scan is about 5 centimeters. Let's start scanning. Place it horizontally to find a structure with two bones. You can see high brightness in the middle. The parotid gland is high in response. The echoes on the two sides are bones. After the probe is positioned, you can move up and down and tilt a little. When you finish scanning in transverse view, you can turn your probe 90 degrees and scan again to observe its overall scanning results. You can save images in the device to review later on. That's all for today's tutorial. Stay tuned to see what's coming next.